Okay, well, hello everybody. I'll just end the poll before we start the session tonight so everybody can see the responses. So I'm sharing the results now, and what I can see is that most of us are very worried about climate change, and we talk about it a little bit with our friends and family. We know that it's a health issue, and we sometimes talk about it at work, but a little bit less often than we talk about it with our friends. So I'm just going to share my screen now and we'll start the presentation. Okay, I'm hoping everyone can see that. Kylie, if you could give me a thumbs up, that'd be great. All right, I'm going to...
Oh, good, Kate.
Great, thank you, Kylie, and away we go. Climate change is a health issue. Climate change is highly politicised and it's often talked about as an economic problem. But climate change is a health issue. We need to treat it. We need to treat climate change just like we do any other life-threatening medical condition. We need to act to reduce harm. We need to try to repair the damage that we have made. We need to stop making it worse. And we need to prepare ourselves for our changed world. Because if we don't start treating climate change, if we don't start acting in the knowledge that we need a healthy planet to have healthy people, then we face a dire and uncertain future and even risk our own existence. Thank you for coming. My name is Kate Wylie. I'm a GP. I'm here tonight representing Doctors for the Environment in the first of our After Hours webinar series. It's the first event, so this is an introduction to climate change and human health. Before we proceed, it's really important that we acknowledge country. The nation called Australia is stolen land. First Nations people have never ceded their sovereignty of their land, and respect is owed to all Aboriginal and Torres Strait Island nations and First Nations people. I'm on Kaurna Yurta, so the Kaurna land of the Adelaide Plains. Greetings to a group of people in Kaurna is Namani. So Namani to you all. I think it's a sign of respect if we all write the name of the land that we are on in the chat, and so I ask that we do that, please. Doctors for the Environment, we're a not-for-profit organisation of doctors whose fundamental objective is to protect and enhance health by protecting the environment. I've been a member of Doctors for the Environment for about 5 years now. This is a picture of a group of us when we put on a filming of guarding the Galilee Basin about 4 years ago. This is me at a rally. These are some stickers I got made up once. I have my own advocacy project called Climate Medicine, and I'm also a member of the Climate Reality Leadership Corps, having done the Al Gore training. And this is a picture of my dogs. This is Ella and this is Chloe. And the reason why they're there is because even though we're talking about the human health effects of climate change, what we're doing to our planet also affects the natural world. And, biodiversity loss is also a very massive problem. And, the animals, they didn't ask for it, but they're certainly being affected by it. So tonight we're going to do the basics of global warming. We're going to look at some of the major health impacts. Then I'm going to present 3 case scenarios that I've come across in my own clinical practice. And importantly, finish with what we can all do. How do we treat this problem? How do we become part of the solution and not part of the problem? So first, the basics of global warming and climate change 101. So basically, burning fossil fuels releases greenhouse gases. which increases the greenhouse effect, which increases the temperature, causing more extreme heat and changing the climate. So when we burn coal, oil and gas, we release carbon dioxide, methane, nitrous oxide and a whole slew of others, and these gases become incorporated into the gaseous layer that surrounds our planet and acts to keep heat in. The denser, the thicker this layer, the more gases, the more heat is reflected back to Earth and the hotter the temperature is. Currently, CO2 levels in the atmosphere are 416.51, or they were on the 14th of February. February last year, they were 414.12. 10 years ago, 390 something. The pre-industrial base is 280, and the safe level has been given at 350. So CO2 levels in our atmosphere are continuing to rise. I also think it's important to realise that when we're talking about an increase in temperature, we're talking about an increase in the average temperature. So, I remember thinking, I don't know, a long time ago now, 1 degree, 2 degrees, why does it matter? If it's 25 or 26, I can still take my dogs for a walk. But when you plot temperature on a bell curve, you start to see that this increase in temperature makes a massive difference. So using Australia as an example, back in the olden days, between 1960 and 1991, the average temperature in Australia was 21.8 degrees. And so lots of days the weather was really lovely, and some days it was very cold, and some days it was very hot. In 2019, the average temperature in Australia was 23.3 degrees, shifting this whole curve to the right. And what that means is even though some days are lovely and some days are still very cold, we now have more hot weather and more extremely hot weather. And this changes our climate, and we see the devastating bushfires that we had the summer before last. Australia's warmest year on record was 2019. And basically the last decade has been the hottest decade in Australia and across the planet. This square is more than 10 years old. It was made in 2007, and it shows that the scientists were right. They titled it at that time, How Will Climate Change Affect Australia? I've changed it, is How Does Climate Change Affect Australia? Because we're seeing all these things now. We're seeing cyclones that are more intense. We're seeing extreme rainfall events. We're seeing hotter and drier conditions, and look where those fires are. We're seeing heat waves across the country, sea level rises, the thunderstorms and the droughts. And when we look at that on the ground, you see the massive fires. This is Kangaroo Island, just down the road from where I live, a before-after photo of the same road after the devastating fire that went through there the summer before last. We're seeing dry riverbeds. Current day, our global warming is about 1.1 degrees and 1.4 degrees in Australia. Obviously, oceans are affected too, with increases in ocean temperature, increased ocean acidification, loss of sea ice, and sea level rise. And when we look to the future, when we look to our global greenhouse gas emission scenario, so the projection of what's coming, things aren't really looking very good. If we keep going, if humans keep going on our current trajectory, we're looking at between 4.8 degrees of global warming by the end of this century. If politicians do what they say they're going to do, we're looking at somewhere between 2.6 and 3.7. But to get to that 2 degree pathway or 1.5 degree pathway, which is what we really need to be doing, we need to be rapidly decarbonising the way that we live our life on this planet to protect ourselves and protect our future. It's fortunate that there are good humans in this world, and the Paris Agreement was signed in 2016. 196 member states signed that agreement, including Australia, and at that time they agreed to limit global warming to less than 2 degrees and as close to 1.5 degrees as possible. At that time, the IPCC, so the Intergovernmental Panel on Climate Change, was commissioned to write a 1.5 degree report where they looked at the difference between 2 and 1.5 degrees. Did that half a degree really matter? And they handed down a report in 2018, and basically it said, yes, it does matter. for us to have a livable planet, for us to avoid the worst catastrophes of global warming, we really need to limit to 1.5 degrees. We're looking at reaching that temperature somewhere between 2030 and 2050. So it's, it's on the horizon, it's happening soon. And what they also said was for us to have a 50% chance, so 1 in 2, a toss of a coin, a 50% chance of limiting global warming to 1.5 degrees. We need to halve global net emissions by 2030 and reach zero by 2050. And that is a massive undertaking. That requires everybody to be involved, all individuals, all institutions, all governments, all businesses, to do more now to be rapidly decarbonising our world. Unfortunately, the climate change propaganda machine is extremely effective, and they have been responsible for a deliberate misinformation campaign for the last few decades to stymie the transition to a carbon neutral world. Basically, they're getting in the way. And they say things that I'm sure everybody here has heard. The climate changes anyway. Well, yeah, it does, but it's the rate and magnitude of the change that's the problem. Or they'll say the scientists don't agree. That's not true. We now have greater than 99% global scientific consensus that our burning of fossil fuels is causing global warming and changing our climate. Or they'll just deny. The scientists are wrong. So NASA can put humans on the moon, but they can't measure the temperature. And I have a little clip here from NASA. It shows the global temperature anomaly from 1880 to 2018. There isn't any sound, and I'll just sit back while we watch that. Okay, so that's pretty confronting, isn't it? And unsurprisingly, it has massive effects on our health. So climate change has been called the biggest global health threat of the 21st century. The World Health Organization estimates that between 2030 and 2050, it's going to be responsible for an additional 250,000 deaths per year from malnutrition, malaria, diarrhea, and heat stress. So that number does not include deaths from smoke inhalation, pollution, other infections, mental illness, extreme weather events, migration and conflict, all of which have their own disease burden. Climate change truly is a health emergency. The World Health Organization is pleading for urgent action to protect health because of climate change. They're currently preparing a special report for COP later this year. Climate emergency declarations have been made by the World Medical Association, WONCA and the Planetary Health Alliance. And in our country, climate emergency declarations have been made by the AMA, the RACGP, ACRIM, the RACP, the College of Emergency Medicine, and a whole slew of other professional organisations. The RACGP released their Climate Change and Human Health Position Statement in 2019, and in that statement, they basically recognise that climate change is a key public health issue. They commit to mitigation and adaptation strategy. They advocate for policy to protect health, and they consider it important for GPs to learn about it, communicate about it, and research it. So for the GPs in the audience, good on us, let's get going. This is an overview slide of the impacts of climate change on human health. And so if we look at, we've got increased CO2 levels, the rising temperatures, more extreme weather, sea level rising, and of course that means there's extreme heat with heat-related illnesses and death, severe weather with injuries and fatalities surrounding that, air pollution with asthma and cardiovascular disease being the obvious effects of air pollution, changes in vector ecology, with malaria and dengue worldwide being the standout diseases there, increase in allergens, respiratory allergies and asthma, effects on our water quality with the diarrheal diseases and in particular cholera being the biggest problem there, water and food supply impacts with malnutrition and diarrheal disease, global warming is one of the greatest causes of food shortages worldwide. And of course, environmental degradation with forced migration and civil conflict. To summarise it, I think the big six are heat, fire, smoke, food and water insecurity, infectious diseases, and of course, mental illness. And I don't think you can look this problem dead in the eye without being psychologically affected. I know I certainly am, and I know a lot of people that I know in this space are too. For those of you interested in the research, the Lancet Planetary Health Journal is a fabulous place to look for information on this. The Lancet publishes an annual countdown every year. They started in 2015, where they look at how we're going from a climate and health perspective. They look at climate change impacts, exposures and vulnerability, adaptation, planning and resilience, mitigation actions and health co-benefits, economics and finances, and the public and political engagement. In 2018, the Medical Journal of Australia joined with the Lancet to publish their sort of Australian version of this. And I have to say that the 2018 version of this report is a fabulous read and really helped me kind of get my head around it, and a great place to start. So let's hear from the Lancet now and about their 2019 report.
Our response to climate change today will determine the world we live in tomorrow, and will shape the health of children across the globe at every stage of their lives. The Lancet Countdown, tracking progress on health and climate change, monitors our choices, demonstrating what action, or the failure to act, means for human health. There are many paths we can take, from a world of extremes and uncertainty, where a child has to fight simply to survive, to an environment that creates the conditions that allows them to thrive. If we continue down our current path, a child born today will live through a world that is over 4 degrees warmer, with a changing environment threatening the food they eat, the air they breathe, and the communities they grow up in. Air pollution, already dangerously high in more than 90% of cities, will worsen and further damage their hearts and lungs from the moment they take their first breath. As they grow, food insecurity will rise, with children among the worst affected by the malnutrition and stunting that comes from crop failure in a more volatile climate. Throughout their adult lives, they will experience more heat waves, stronger storms, the spread of infectious disease, and see climate change intensify mass migration, extreme poverty, and mental illness. But the future doesn't have to look this way. A global response that limits temperature rise to well below 2 degrees will transform the life of a child born today for the better. Children in the UK will see an end to coal by their 6th birthday, and the growth of solar and wind energy, resulting in cleaner air across the country. In France, the last petrol car will be sold by the time they turn 21, with cycleways and green spaces supporting safer and more livable cities. And they will celebrate their 31st birthday as the world finally reaches net zero emissions, securing a healthier future for coming generations. Which of these two pathways the world travels down will depend on the decisions of individuals, businesses, and governments. And only an ambitious response can ensure that the health of a child born today isn't defined by a changing climate. Visit the Lancet Countdown online to find the latest assessment of the state of health and climate change in your country.
Okay, so what I like about that is it shows us that we have a choice. You know, which way do we go? Do we survive? Do we thrive? And it's up to us to say, the time is now for us to make those choices, for us to act, to us to work together and create a better future. So for the next bit of the talk, I'm going to present 3 clinical scenarios that show how climate change is already affecting health of people in this country. Obviously, they're not actual cases, as anybody can tell by the name of our first patient here, but they are scenarios that I've come across in my workplace. They're sort of conglomerations of people that I've met. So clinical scenario number 1 is a heat scenario. Here we have Mrs. Isoramento da Calore. She's an 82-year-old woman who collapses in your waiting room on a hot summer's day. The last 4 days, the temperature has been greater than 35 degrees and it's stayed really hot overnight. Mrs. Di Calore lives alone and she's on the pension. She has a history of hypertension and heart failure. She's got arthritis, a bit of a bad back, and she doesn't sleep very well. She's on Carbasil Plus, Lasix and NDEP. So let's look at her. She's got a number of risk factors for being affected by heat. Obviously, this is a heat scenario. Mrs. Da Calore is having heat exhaustion. And we can see that over the last 4 days, the temperature's stayed hot, and this fulfills the definition of a heat wave. So it's been hot, it's stayed hot overnight. She lives alone, which means there's no one to kind of remind her to turn on the air conditioner or the fan or to check on her. And we know that as people get older, they don't recognise that they're getting hot quite so well. Also, she's on the pension, which means she doesn't have much money and she's probably a little bit worried about her electricity bill. She's got a number of physical things that make it harder for her body to respond to heat, heart failure being the obvious one. And she's on 3 medications that dry her out. This is a pretty common kind of scenario. We've all got, any health practitioner in the audience has patients like Mrs. Di Calore. And it's important that we recognise this because heat waves are Australia's most deadly natural disaster. Heat waves are responsible for 1,100 deaths per year. That's the 2017 number, and that's only going to go up over time. Certain groups are more vulnerable to heat than others, with the elderly by far being the most vulnerable, but also very young people, pregnant women, those with mental health conditions, those with underlying medical conditions like diabetes, heart disease and kidney disease, people who work outside. Poverty is obviously a risk factor, as is homelessness and living in a city. So the urban heat island effect is really marked. And on the right, I have a map of Adelaide, where I am now, and showing, you can see these dark orangey red lines, and they're all the roads. And so the bitumen and the cement really absorb heat, and then that gets reflected back overnight, and so you don't get the cooling effects of nighttime temperatures. Obviously, this lovely blue line is the river, and that's where you'd want to be hanging out on a hot day. So obviously heat causes heat exhaustion and heat stroke. It also increases the risk of heart attack, CVAs and kidney disease. In our 2009 heat wave in South Australia, where it was really hot for about a fortnight, there was 400 excess deaths, with the highest incidence in mortality caused by the direct heat in the older age group, followed by heart disease in a sort of a younger cohort. I appreciate it's a very broad age range there, and stroke-related deaths in 65 to 74-year-olds. And we also can demonstrate that there's an increased risk of kidney diseases during the heat, and obviously we need to be aware of that. So heat exhaustion is a serious problem, and obviously if someone came into you and they were heat exhausted, or we saw someone on the street looking a bit affected on a hot day, we're going to try and cool them down. We're going to lie them down in the shade, get them to drink water, put a cool compress on their head, that kind of thing, maybe put a drip up. Because if a person decompensates, if they get past the ability of their body to cool themselves down, then they are at risk of heat stroke. And heat stroke is a medical emergency. These people need emergency care straight away. Get thee to ED, basically. So that's number 1, heat. Clinical scenario number 2 is a breathing scenario. So we have Mr. Senza Rispero, who's 16 years old, and he presents to your practice with shortness of breath and cough. You're in Sydney, and there's been bushfires burning in the surrounding hills for the past 3 months. That day, the air quality index is 400, and I'll explain what that means in the next slide. Senza identifies as Aboriginal. He lives with his family and he's in year 10, and he's got a history of asthma. So obviously in this kind of scenario, we're going to be checking his oxygen saturation. We're going to listen to his breathing. We might give him some oxygen, give him some Ventolin, do all the things that we all, understand what to do. But let's look at his risk factors. So we've got the bushfires burning. We've got a really high air quality index. Senza identifies as Aboriginal, and we know that people of socioeconomic disadvantage are worse affected worldwide and in Australia by the health effects of climate change. He's also in year 10, so he's an adolescent, and adolescents commonly perhaps don't look after their health as well as we would hope that they would. Adolescents tend not to listen to people over 30. And he has a history of asthma. So he's got a number of things that mean that he's more likely to be affected when the air quality index is poor. So yeah, air quality index is a number that is derived from the amount of pollutants in our atmosphere. And it measures, it's a sort of made number from the levels of ozone, the particulate matters 2.5 and 10, carbon dioxide, sulfur dioxide, and nitrous oxide. Between 0 and 50 is good. And then as we go up the numbers, depending on whether you've got underlying respiratory diseases like asthma, or if you're going to be outside a lot, your risk increases. Once we get above 300, we're in the hazardous range, and the recommendation is everybody should be avoiding outdoor exertion. Everybody is at risk of serious health effects. In my scenario, I gave the number of 400. We know that during the catastrophic fires, we're getting numbers far greater than that, with an example of 518 in Sydney on January the 8th, 2020. So yeah, pollution is a massive problem. During those fires, this study by Arigada et al. Looked at hospital admission data from October to mid-February, and they found that there was 417 excess deaths from the smoke, not from the fire, but from the smoke. More than 1,100 hospitalisations for cardiovascular problems, more than 2,000 for respiratory problems, and more than 1,300 presentations to emergency department with asthma. So smoke inhalation is a major health effect of climate change. Pollution, this is only the beginning of the health effects of pollution. Our next after hours webinar series, which will be the 3rd Wednesday of next month, is on pollution. Just a little plug there. And clinical scenario number 3 is mental illness. So this is Ms. Ansia Ecologica. She's 24 years old, and she comes into your room one day with anxiety and panic. When she talks further, she says that she's worried about global warming, and she's overwhelmed by sadness and anger. She's very politically engaged, but she's disillusioned about the future, and she's decided not to have children because why would she bring them into this world? Lately, she's stopped attending uni and going out. What's the point, says Ansia. We're all going to die. I've met a number of young people who present like this. And I now do routinely ask about eco-anxiety and climate grief when I see people with depression and anxiety. Obviously, in this scenario, we'd need to be checking for her safety and treating for depression and anxiety as we normally would. Climate grief is a recognised psychological phenomenon, and of course it's the grief felt in relation to experienced or anticipated ecological loss. And eco-anxiety is becoming increasingly recognised as well. Certain groups are talked about as being at higher risk, so younger people, First Nations people, those in relevant fields like scientists and farmers and doctors, I might say. But really everybody's at risk of this, because as we see our world change, we're not going to be able to escape it. It's going to affect us. the Australian Psychological Society has put out this wonderful little activate sheet. And, you know, I find this really helpful. Basically, A is to acknowledge feelings about climate change so that you can manage them and not avoid the reality of climate change, because we really don't have time for denial about this. We need to create social norms about protecting the environment so that it's normal to be green. That's the sociable thing to do. We need to talk about climate change and break the collective silence so that more people realise that we need to do something. We need to inspire positive visions of a sustainable future. You know, the solutions to the climate crisis already exist. We just have to get on and do them. We need to value our environment. We need to act to contribute to climate change solutions. We need to recognise that the time is now. You know, what I showed before about the 2018 report, you know, we need to halve global emissions by the end of this decade. You know, this is the time to create the paradigm shift. We really need to get on and do it. And lastly, engage with nature, because that makes you connect to what it is we're trying to protect, and it makes you feel better. So to finish up, I want to talk about what we can do. How do we treat this? You know, we have a responsibility, healthcare practitioners and all of us on this planet have a responsibility to look after the health of humanity and act in its best interests. I think health practitioners are the ideal group to educate and activate our communities. We're in every community throughout the country. We're in the city, we're in the bush, we're in every social strata, culturally and linguistically diverse communities, you name it. Medical practitioners, health practitioners are there. We have the ear of the populace, and we have a reach that, you know, other groups, political groups, would dream of. And so because we have that reach, we have the opportunity to advocate for a health-based response to global warming. We can engage with our professional organisations, we can engage with our political representatives and within our communities. So yeah, we can engage with on a number of levels. So our patients, our practice, our communities and ourselves. And so how do we do that? So firstly, our patients. Let's talk about it. This is the most important health problem facing this century. We're allowed to talk about it. We can talk about the health benefits of action. So, you know, when we're talking to people with diabetes or heart disease and we're trying to encourage them to have a healthy diet, let's talk about the planetary health diet. This is a diet that is basically plant rich. It has a little bit of animal product, but basically a plant rich diet. And it's been formulated to allow us to feed our current population with our current farmland. And we know that our current agriculture is responsible for about a quarter of global emissions, with you know, animal products, especially beef, being the greater emitters. So if we don't eat those, we help mitigate the effects of climate change. So a healthy diet, active transport, you know, is good for your planet, it's good for you. So walking, cycling, public transport. This is a picture of my electric bike, which I really, really love and couldn't help but put in there. And also we can incorporate climate and health into our care plans. So with a patient like Mrs. Duckalore, why don't we put heat waves into her care plan so that we help her know what to do on those hot days? For people with respiratory conditions, let's get them to monitor the air quality index so that when it's above a certain level, they know what to do, we protect them. Let's put disaster action plans in everybody's care plans so that when there's a fire, they've already thought about it. And by us putting those in the care plans, we normalise the conversation. We start making the connections between climate and health to our patients, and therefore help shift the narrative. Also, we should be considering their medications and whether or not we're placing them at risk with what we're prescribing. We can do good work in our practices. So by greening our practices, like getting solar and panels, recycling, reducing waste, reducing plastics, all of those things that we know that we should do. We can also consider greening our prescribing, so choosing medications with a lower impact. It's quite hard to get data on the sort of footprint of a lot of scripts. but we do have it for asthma medications. So this is a lovely thing that came out of the UK. And at the top, here's our good old salbutamol puffer. And one of these puffers is equivalent to driving a typical car 175 miles, so from London to Sheffield. And down the bottom, they've got a Ventolin Accuhaler, and that's only 4 miles, so driving from London to another bit of London. I mean, we can't write scripts for Ventolin Accuhalers in Australia, but we can certainly write scripts for other Accuhalers and preventers and help use these less. We can green our pathology ordering as well. We can engage with our communities, so getting involved with climate health groups. Obviously, getting involved with DEA is a good idea from my perspective. There's also the Climate and Health Alliance, and the RSCGP has a climate and environment special interest group. Engaging with our communities, so presenting on climate and health at local council and community groups. I've done this a number of times, presented at my local library. It's actually heaps of fun. Most people are really lovely about this. We don't need to be scared. And it has allowed me to now start having more conversations with my practice population around climate and health. They know that this is something that I'm passionate about, and they're happy to talk to me about it. Joining community groups, so getting involved in the movement for change. There's so many of these out there, the Wilderness Society, Parents for Climate Action, all those things. We can all get involved with tree planting schemes and beach cleans and, you know, getting in the garden. And the last one I've got is ourselves. So we're fated with being alive at a most important time in human history. And so when we're thinking about what we individually can do to be part of the solution to the climate crisis, I find it easy to think about it in this way. So F is for finance, so divesting our money from banks and financial institutions that loan to fossil fuel industry, and putting it in ones that don't. Market Forces is an excellent website to look up to get information about what your bank is like. If you have investments, we should be investing them ethically. Most carbon offset schemes are basically tree planting schemes, and getting involved with those is a good thing that you can do to help. A is for advocacy, so voting for climate and engaging with our politicians. You know, our politicians are there to represent us. We're allowed to tell them what we think. And this is a picture of me when I went and visited my local member, Tony Zappia, a number of years ago. DEA commonly talks to politicians as part of our advocacy work. And so if people are interested in doing that, you know, become involved, join us. T is for transport, so walking and cycling, getting an electric vehicle. I mean, if you've got 50K to spend on a car, get an electric car. Using public transport when you can. E is for energy, so switching to a renewable energy provider. That's as simple as switching your bill. It's a pretty easy thing to do. Getting panels and batteries. And D is for diet. So as I already mentioned, the planetary health diet, or basically following a plant-rich diet. So that's me. I'm going to stop in a minute, and I do have some post-poll questions for us, and the evaluation form is in the link. But to finish off, I just want to say what I've just presented is pretty heavy. It's, you know, what we're facing is big and hard and overwhelming sometimes. But what I really hope is that you're listening and can see things that you can do to be part of the solution, ways that you can help make a positive impact on our world, because, to be really cheesy, you are the antibodies kicking in as the planet fights its fever. All right, thank you for listening. I'll stop sharing. All right. So, okay. So I'm wondering if there's any questions in the chat. Oh, lower hand. Thank you. Thank you, Vicky. So I can see that we've got the link there for people to do their evaluation form. That'd be great. And I'm just trying to set up our post poll, which somehow, okay, shared that was poll. Somehow I can't find it. I have a question. Regarding sharing, this is recorded. So, yeah, so regarding sharing, this is Nagara, this session is recorded. And so you'll be able to watch it pretty soon by going to the DEA website and clicking on the link. Thank you. Thank you for wanting to.
Kate, I think Dimity had a question about ordering green pathology in the chat.
Yeah, so what I really mean about that is avoiding unnecessary ordering. So obviously everything that we do carries a footprint, and you know, why get unnecessary things that we don't need to do. Obviously the same thing applies to radiology. But I suppose, Dimity, I know that you're very interested in green prescribing, and you know, one of the things that we can actually do to help people's health is encourage them to engage in nature, to be, you know, get out there and exercise and engage in that way. What else have we got? Dear Doctors for the, so I've got one from Joe Barkworth. Does Doctors for the Environment lobby the government either directly or via the Department of Health? Yes, absolutely they do. Doctors for the Environment has state-based groups, and every state tries to engage with the politicians in their own state. We often have meetings with the health ministers, shadow health ministers, pretty much anybody who will let us go and talk to them. Only this week, DEA members and some CAHA members were at the federal parliament talking to a number of politicians there. So yeah, absolutely, we're very much involved in lobbying for political change. I think we all recognise that it's vital that we have a political response to the climate crisis. Yeah, and Simon Judkins has asked a question. Our health systems contribute enormously to our carbon footprint. How can we put more pressure on hospitals to do better? Yes, so, you know, the healthcare sector carries about 7% of Australia's emissions, which is a big number. Just today, DEA and the AMA released a joint statement asking for hospitals and, well, for the healthcare sector to reduce its footprint by 80% by 2030 and to zero by 2040. I might be wrong there. How do you hassle them? I suppose one of the things is knowing that you've got DEA and AMA and CAHA wanting that to happen too, talking to the people in your own hospitals about it, and, you know, advocating for political change. And we've got a question from Wendy. Is Doctors for the Environment including climate change health impact in Victorian government inquiry on air pollution? Wendy, I'm not in Victoria. I'm pretty sure we are. We do have a very active pollution special interest group. I'm happy to take that question on notice though, Wendy. I do know some people really involved in that and could get back to you with that if you'd like. And how many more have I got? All right, and we've got Brianna Orman, great presentation. Thank you, Brianna. I'm very early in my medical career and was just wondering what the attitudes towards having these kind of conversations are like amongst medical professionals. It's varied. It's varied, Brianna, just like it is with all of our society. So you do have some people who are climate change deniers in medicine, and then you have people who are absolutely aware of it and advocating for change. But, you know, I think most of us are pretty rational creatures, and the more that we educate, the more that we talk about it, and the more that we normalise the conversation, the more that we can help everybody get on board. I'd really love to see all health professionals in Australia working in this space, working together, because, you know, as I said right at the beginning, climate change is a health issue, fundamentally a health issue. And, you know, it's our job to look after human health. Yeah. And what have we got? Nicole Minchin, are you aware of any companies that sell more environmentally friendly medical supplies for GP practices? No, I'm not, Nicole. I wish I was. I'm looking in the chat. Does anybody else have any answers to that? Because it'd be lovely to know if anybody does. It is one of the things, you know, one of the greening problems is like all the waste of plastics and stuff that we use all the time. And I just checked the chat from an earlier question. Thank you, Vicky Kotsiroulos, about, I'm assuming that you're saying that DEA is responding to the Victoria, the Environment Lobby, the government, the Department of Health about pollution. I'm assuming that's what that was. Yes, we are putting a Vic submission, working on it this weekend. Good on you, Vicky. And then Australia has largely moved to one-use instruments. Is there any move to go back to reusable instruments? Yeah, well, this is the thing, isn't it? You know, I think in some ways that we can, like there's some things that you can use your autoclave and reuse them. You know, surgery, I think, is the biggest problem. There's so many things that we just dispose all the time. It's one of those things where if a person was really passionate about it and they wanted to advocate their local health centre, you know, where you work, and try and, you know, encourage people to do that, then that would be a, you know, a positive contribution. And yeah, thank you, Vicky. All right. Okay, I think we've done it. All right, look, thank you everybody so much for taking the time to listen to me talk this evening. I really do appreciate it. Thank you so much for coming. As I said at the beginning, this is the first of our After Hours webinar series. We're planning to do one of these a month. The next one will be on air pollution. That'll be on the third Wednesday of next month. And the one in May will be on diet and climate change. And the one next month is presented by Dr. Ben Ewald, who is a GP academic who's written lots of papers on pollution. And the one in May on diet will be presented by Dr. Rosemary Stanton, who is a well-recognised expert in dietary change. All right, and all right, I think we can wrap it up there. Thank you all so much for coming, and I really appreciate you being here. Okay, bye-bye.